we do again have Marilyn Hayes with Calarity with us, and she has brought with her, and I hope I'm pronouncing this name right, Dr. Ioma Emenuga, the Chief Medical Officer with Family Health Centers of Baltimore. So again, all of the Calarity team has been made co-hosts, so please feel free to share your screen. Thanks so much.
Thank you, Zep, very much. We are so excited to be able to present to this group. We've enjoyed working with you, Zep, and Emily, and a smaller portion of your team in preparation for today's meeting. I'd first like to introduce the Calarity team. Besides myself, Dr. Parvalina, who is an internist and the founder and CEO of Calarity, is on the call, and Cam here, our Director of IT, is on the call. But most importantly, we have our special guest, Dr. Emenuga. She works at the FQHC as the Chief Medical Officer for FHCB, Family Health Centers of Baltimore. Previously, she was the CMO at Park West Med Center in Baltimore. She has a long history of work with FQHCs and public health. An internist by training, she did get her medical degree from the University of Nigeria, her Master's of Science degree in Public Health from London School of Science and Hygiene and Tropical Medicine, her Master's of Business Administration from the University of Maryland, College Park. She did her residency fellowship in health policy from the George Washington University RFHP program and her residency training in internal medicine at Howard University Hospital in DC. She served as chief resident while there and also was later an associate program director of the internal medicine residency training programs. So you can tell she has a lot of credentials. Excuse me for reading that, but I could not memorize it. Thank you very much, Dr. Emenuga, for joining us.
Thank you for having me.
Dr. Emenuga, this is Parvalina. I'm shared my screen, which has my phone, and what we were going to ask to do. Zep, did all the attendees get an overview of what we're talking about? Do we have to provide any context before we have Dr. Emenuga sort of go over a little bit of?
Yeah, if you guys could provide an overview just to make sure, because we did invite providers as well to this meeting. So if they were able to make it, then we would need to share that information.
Okay, great. Let me just switch over, and we're going to end up going here anyway. So this is our website. Calarity has three focuses. The main one that I think all of you would be interested in is we're going to have Dr. Emenuga, who uses Calarity, explain how she creates clinical documentation without having to necessarily do the typing. And that's what, for the most part, everyone is focused on. We take those recordings in some cases and can share those. The audios will get turned into documentation for the providers, but we do have the ability to share the same audios with patients, either through your portals or on the Calarity app for the patients and the families, so that whatever is said and recommended and all the things you outline to patients, in some cases, is a bit difficult for them to recall or understand, and family that can't make the appointment can listen to the conversation and help their parents or spouse or partner follow through. And then the same audios are being used by training programs, medical schools, other training programs for nurse practitioners and so forth, to listen in on the conversations between the clinician and the patient to try to teach and coach the physicians or the students to be more effective and get through the visits a little bit better. So those are the focuses, but really the main reason we got the chance to engage with Zep and the team was the opportunity to have a high quality, very affordable way to create documentation. With that, I'm going to just turn it over to Dr. Emenuga, who can perhaps start by explaining how she went through the process of what the problem was she was trying to solve, and then we can begin the demo, and I'll switch over to the app. Dr. Emenuga?
Thank you. Good morning, everyone, and thank you again for having us. So part of the reason why this is so important, I think for every clinician leader who's here, any team of providers, and for any clinician on the front lines, one of the challenges that people are talking about a lot today is just the challenge of administrative work that's related to clinical work. You finish seeing your patients, you have a whole lot of documentation to do. And as a clinician leader, it really does break my heart. I look at my providers, I know they're doing their best, but the burden of documentation is a lot. Now, it's even more special in the community healthcare world or the FQHC world because even though our patients need much more than most patients outside of community care, we also have more resource constraints. So we have more needs, but just less money, period. And when I started to look for a way to ease, and I'm not saying that scribing is the end all be all of burnout or work-life balance, but it is one thing that we can offer our providers and our clinical teams to enable them to keep up with the administrative burden of the work. It was hard for me to find an affordable tool that I could offer to our teams. Now remember, we're in the FQHC world. Whatever tool I find, I have to present to my CEO and my CFO and justify it. And they were very expensive. And so as I asked around, a friend of a friend connected me with this. I think this Clarity might have been the seventh, either the sixth or seventh scribing program that I had demoed and reviewed. And when I saw this, it answered all the questions I needed. I didn't want too many bells and whistles because I needed it to be affordable, but I did need it to actually help people. And that's what I found. I started to use it myself to see patients just to make sure that it was as good as it said it was. And then I introduced it to my chiefs of service and went ahead to introduce it to our team. So what we want to do today is show you how this tool can be used. And I'm going to start with the way most providers tend to use it, which is to document the note after they finish the visit. They go through a day of patients, could be 10, 20 patients per day, depending on whether it's a full day or half day, and then go ahead to document. So what PAR has on the screen is the way it looks on my phone that's not showing up. But eventually, when I finish the note, I will share my screen and you'll see where it's going. And so the first thing you would normally do, PAR, you might want to go back to appointments and then click, if you look at the sandwich on the left of Clarity and click appointments, then you can click on new appointments. And remember, this is all on your smartphone. So the way that most providers will use it would be to pull it up on their smartphone this way. I'm going to use my initials as the patient, so I'll just put I for the first name and E for the last name. And then I'll click. You click plan. And so at this point, like I said, I'm going to demo two ways. Most providers will get to this point after they're done for the day, and then they sit down gradually and start to dictate their different patient visits. So let's assume this is lunchtime. I'm going to dictate the patients I saw in the morning. I'm going to start with patient IE. So as soon as I sit down and I click start, this is how you would start. So this was a 42-year-old female seen in the clinic today for chronic disease follow-up. Her review of systems and physical exam were within normal limits. Number one, hypertension. Blood pressure was elevated in the clinic today. The patient did bring in her home blood pressure monitor. Her blood pressure records from home were high, consistent with what was seen in the clinic today. Of note, the patient's blood pressure monitor was calibrated in the clinic during her last visit. We have increased her losartan today from 25 milligrams to 50 milligrams daily. We have also provided education around the DASH diet. Patient understands this. The patient will return to care in about 2 weeks to reevaluate her blood pressure and titrate her medications accordingly. Number two, hyperlipidemia. The patient reports good adherence to her statin regimen. She has been on the medication rosuvastatin for about 5 months. She also reports lifestyle and dietary modification in keeping with previous education. We will order a fasting lipid panel today, patient will be contacted once the results are available, and she will return to care for her usual schedule. And so this is done with patient IE. Once I dictate this, I click pause, and then I can click done. Now, what many providers will do at this point is they'll wait for these notes and they'll go on to the next note and the next and the next. And then they'll go on, log into their Calarity account, and you will then see those dictations. Now, if I go onto my account, so I can share my screen. Pa, are you ready? Would you like us to use yours instead then?
I was just going to show it on the app first, but you're right.
Go ahead.
We can do it both. It takes about a minute and a half for it to render. Just wanted to say that towards the end, Dr. Emenuga, maybe my Wi-Fi went off, but I just missed maybe the last few words. So the quality of this is obviously not normal. You would be using your own phone in the room. I'm using my phone, listening to my laptop through Zoom, but still it should be pretty close. And then you'll be able to edit it both on the phone, which is what some people do, or if you were doing it like Dr. Emenuga said at lunchtime, you probably would have your laptop open and you'd be knocking these out one after the other. I think it caught. I'm sorry. I started running the recording when you said this is how you would start, so I would probably quickly edit that out, and we would just fix that, and I'll quickly save it. But you can tell that as Dr. Emenuga was speaking, she was just verbalizing. She didn't have to put any of the punctuation. It does a pretty accurate job of catching it. And even with the medication names, it does a pretty good job. And I thought there might be a little hitch there at the end, but it looks like it caught it pretty well. So this is her knocking out a patient. I didn't notice the time, Dr. Emenuga, but I thought you might have dictated in about a minute and a half.
Yep, you're correct. It was 1 minute and 40 seconds. Yeah. So that's one patient done.
Yeah, exactly. Do you want to quickly, before we switch over to the portal, do you want to show us how this was a pretty standard way that Dr. Emenuga did it, which is after the visit, you have a bunch of patients that you might have seen, you might have jotted a few notes, and then you start knocking them out one after the other. That is pretty standard the way a lot of you might have been exposed to using Dragon or something like that. It works really well. The difference is you don't have to put the periods and the punctuation, which I think is probably a little easier for those that have never dictated. And but the way Dr. Emenuga and a few of the other providers do it is very interesting, and we would love for her to demonstrate where, let's say, I'm the patient and she's the physician. So let me just set up another visit here. Let's say I'm the patient, so PB. And Dr. Emenuga, are you ready to do another case?
I am. So give me 1 second. I'm going to pull it up here. And so understanding that this second demo is me speaking to the patient, it is important for me to point out something. I live in the state of Maryland. In Maryland, we have a two-consent law, which means you can't record a conversation except the second person also provides consent. Now, that's not impossible. Most patients will provide consent. But I always point out that we're in a very unique space where we practice medicine. It's a community health environment. It's an FQHC environment. It's very diverse, and there's a lot of trust issues. And so the idea of being recorded in a visit is sometimes strange to people. And so for my state, for instance, what I'm going to demo is the way I do it, but I do not record the patient. So that way, number one, I don't want to break the law, but also I don't want the patient to be uncomfortable about being recorded and wondering what's she going to do with it. I'm only recording myself. I find this helpful for me because of the speed with which it transcribes, I'm able to finish my visit, address the patient with what I'm about to record, and then go out to the hallway. And within a minute or 2 minutes, it's transcribed. I usually log into Calarity on the same laptop that I use for my visits. So all I have to do is go into my Calarity portal, copy my entire address to the patient, paste it onto my clinical visit summary, and print it. Patient has it, they walk out the door. So this is not done after the fact. I do this in the visit. I prefer to do it this way because it does make things more efficient for me. So having said that, I'm going to Paul, I'll tell you in a minute when to push stop. So I'm going to address myself to the patient PB, and it's going to be the same patient who I just did the HPI for, who came in for hypertension and hyperlipidemia. But because I'm addressing the patient, it will be a little different from when I was writing just the note for record purposes. And we can start. Number one, your high blood pressure. As we discussed earlier, your blood pressure is higher than we would like to tolerate. We would expect the top number to be less than 140 and the bottom number to be less than 90. Therefore, we are increasing your medication, losartan, from 25 milligrams, which you take daily at the moment, to 50 milligrams, which you'll take one pill every day. I'm sending a new prescription to the pharmacy for you to pick up right after this visit. Please try to take your medication at the same time each day. That helps you not to miss your doses. As important as your medication is, we also want to emphasize your lifestyle and your diet. We talked earlier today about the DASH diet, DASH, which stands for Dietary Approaches to Stop Hypertension. So as agreed, you're going to make some different food choices. More whole grain, more fruit, more vegetables, less red meat. You're going to exercise daily. And also, as we discussed, you're going to start a plan to gradually lose some weight. All these things will help you to control your blood pressure. Number two, high cholesterol. You have done exceptionally well, both with taking your medication as prescribed and modifying your diet as needed. I've ordered your new blood test, which you will do today, right after the visit. The lab is on site, right behind the clinic. Either myself or a member of our clinical team will reach out to you as soon as we have the results. Again, great job, and please keep up the good work. Let me know if you have any questions.
Is that it?
That's it.
Okay, I'll
And
hit.
so, okay, so you can click finish. And so usually when I do this with a patient, I have my phone face down on my laptop. And I usually tell the patient, I'm going to summarize our conversation today. I'm going to have you wait for me to finish the summary, and then you can ask me questions. And I do that deliberately so that the patient doesn't get recorded. They wait, I explain everything we talked about, and then I hit stop, and then they can ask questions. While they're asking the questions and I'm rounding up my visit, the AI is transcribing. And so by the time I'm done and I come out to the hallway in order to get the clinical summary, the visit is transcribed, the clinical summary is complete. I can copy and paste it into the CVS portion of the notes and have that printed out by my medical assistant so the patient takes it with them.
So just again, this is pretty atypical. Dr. Emenuga has been practicing for a long time. She's very comfortable with the clinical stuff. This is not what some of the earlier students would do out of the gate. It typically, because you're outlining each problem and the corresponding plan, outlining the second problem in the second plan, the third, and so forth. It's you have to be pretty comfortable sort of explaining and educating, and but if you can do it, it saves a tremendous amount of time in that all of the time you outline your concerns and recommendations to patients are captured in an honest and compliant way. And when it comes to editing and finishing your note at the end of the day, it'll just be a lot less. So let's see how it turned out. So it's a number one. Again, this is a little bit I did have a little, on my end at least, a little fluctuation again with the some of the sound. So it's not, as we discussed earlier, both was higher than, so there is a little bit of editing that I would have to do. And I'm just trying to do this on the fly. But by and large, all of the stuff that that Dr. Emenuga did, most of it will be captured. Certainly at the end of most days, I don't think too many providers would dare spend the time to actually give themselves credit for having outlined diet advice and so forth. At the best, we would say continue treatment or increase losartan from 25 to 50 milligrams, advised on healthy diet, just because we're under so much pressure of time. So I'm just trying to make the edits. Now, you can actually have your staff do this. If you had confidence in your staff, you would give them access. But you know, by and large, it's a lot easier at the end of the day to do this through several of your notes than it would be from scratch to start. I'm just going to hit save. To start from scratch and do all the dictation and try. This is how a lot of the providers end up rushing, just because you're tired, it's late in the day, and you end up not documenting all that you actually did and said. And therefore, again, I'm not sure in the FQHC world whether coding at a level 3 or level 4 matters from a revenue standpoint, but certainly, you know, we end up giving away a fair bit of care just because we don't have the time to document. And so again, imagine if this is to help the provider to be quick and capture the documentation, but technically we could also at some day, if it were ever something the organization felt was worthwhile, particularly in the case of the elderly, you could share this with them and they could in turn go home and hear again. Dr. Emenuga only covered 2 problems, but sometimes you end up covering many, and those are really hard for most of us, even if we're not elderly, to recall. Unless you're taking really good notes, it's really hard to remember how to do that. I was gonna, Dr. Emenuga, do you want to show the portal? Would you like to do that? And if we have time, I could show you one more way of doing this. And I don't know, Zep, if we're getting questions in the chat or if we're going to save questions to the end, but I definitely want to leave a little bit of time for that. Dr. Emenuga?
Yeah, Marilyn has it covered. So Marilyn's responding to the chat questions. So feel free, team, if you guys have any questions, you can load up the chat box.
All right. So, like I said, I usually log into my Calarity portal on the same laptop that I use to see patients, so it makes it easy for me. Again, remember, I'm talking from a community health perspective, community healthcare center, FQHC, where I don't have a lot of resources. And so even though integration into the EHR is possible, that would cost us a chunk of money. So this works very well for me. I log into both on my same laptop. And as you can see, these are all test patients we've used in the past, but these last 2 on top, the IE and the PB, are the 2 we just did. And so in the PB, I'm going to use this in particular because this is the visit in which I was recording it as the clinical summary, which I want to give the patient. In the space of time it takes me to finish up and come outside, once I click on it, you can see right here that it's been transcribed. And it's much easier for me to edit it on my laptop. And so all I have to do is do the edits quickly. Not sure why it's not responding to me. And then I would, oh, okay, yeah. So once I click edit, then I can do the editing quickly. And I'm not going to bother doing that in real time, save everybody's time. And then when I'm done editing, I simply highlight the entire thing, Control C, copy it, go into my EHR, which is on the same laptop, paste it in the clinical visit summary, and I'm good to go. So that's how this is very valuable to me, just because I'm very particular about patients leaving the clinic with a record of our conversation every day, not necessarily audio, but at least something that says when they go home and someone says, well, what did the doctor say? Well, here you go. There has to be something. So a tool that I can use to do this real quick and print it out is extremely valuable to me. This is the way that I use it.
And then Dr. Emenuga, I will share, if I could share my screen one more time. I was just going to ask you this time to be the patient, and I was just going to show you the version that that we're releasing next month. It's a combination of what Dr. Emenuga does, which is during the visit, but some of our providers are finding this is going to be even easier. This is going to be me asking Dr. Emenuga. I guess we could cover the same things: high blood pressure, high cholesterol, whatever. And this is the whole visit. And again, we'll keep it fairly short. But I'm gonna be a physician, and Dr. Emenuga, you be the patient. Let's say you have high blood pressure and high cholesterol, but you came in with some allergies, okay? And we'll try to keep the visit short. And this is us recording start to finish, just to show you what the AI can do. Hi there. So we're here to see you for your follow-up for high blood pressure and high cholesterol. What else? Anything else going on?
Yeah, hi, doctor. I have been sneezing, mostly in the mornings, sometimes in the evening, but it's always when I get up, I sneeze and sneeze. My nose is itching, my eyes are itching. It's driving me crazy.
Okay, now remind me, do you have allergies seasonally or year-round? I don't have anything written down.
I think I do have allergies because I used to take a pill. I think it's a little white pill called Zyrtec. I'm guessing it's for allergies.
That's right, it is. Okay, so you've taken Zyrtec in the past. Have you been taking it more recently?
No, I haven't taken it all year. I didn't think I needed to.
No problem. Well, it could be your allergies. Let me have you pop on the examination table and take a look. Let's see. Let me have you say ah. And
Ah,
okay, great. And I can see some drainage in the back of your throat, a little redness, but there's no little white spots. Let me have you listen to your lungs. Okay, a couple of deep breaths. They sound okay. That's great. Your heart exam's good. I don't feel any swelling or any lymph nodes in your neck. Your skin is nice and warm and dry. Perfect. Okay, so it probably is allergies. But let me, before I forget, your high blood pressure. Are you still taking your losartan every day?
I am every single day.
25 milligrams?
Yes, sir.
Okay, because and let me look at your blood pressure readings. You brought in your device, which is wonderful. So we'll have the nurse calibrate it afterwards as well, which is helpful. And your readings look like they're in the 150s to 160s. And sometimes the bottom number is 95, 98. Okay, so a little higher than we would like. I think we're going to end up having to increase your losartan from 25 milligrams to 50 milligrams, just because your pressure is not really ideal. Let me just make sure, when you check your blood pressure, is it the same time of day, or do you vary when you do check it?
It's the same time as soon as I wake up in the morning.
Okay, fair enough. So it's sort of at the end of your medicine that you take in the morning. And let me ask about taking the medicine. How good are you about remembering to take your medicine?
Every single day. I have a little pill box that has the days of the week. I never miss a pill.
Okay. What about because you take cholesterol medicine too. Which one do you which one do you forget more often, the cholesterol medicine or the blood pressure medicine?
Believe it or not, doctor, I don't forget either of them. I take my medication religiously.
All right, that's fantastic. Well, your lipid profile from last time was fantastic. We're going to have you go to the lab right now. We'll check your kidney and your liver test, but also your fasting lipid profile, and we'll have the nurse call you if it's any variation. But hopefully it's Your weight hasn't changed at all since your last visit, so hopefully it'll be just as good as previously, and we won't have to make a change. But if I were to say things that we need to do for your allergic rhinitis, I do think this is probably allergies, and I think starting the Zyrtec every day, perhaps in the evening, because it sometimes can make you feel a bit drowsy, or at least some people, might be the way to go. If it makes a difference, great. If there's still some symptoms and it's bothering you, perhaps you could even take it twice a day, although watch out for the drowsiness. And we'll see if that doesn't do the trick. Sometimes we have to add a nasal spray, but let's stick with just over-the-counter Zyrtec and starting that back up. For your blood pressure, like I said, the readings that you brought in, plus what we got today, suggest you may be better off increasing the losartan to 50 milligrams every day, particularly because you're reporting that you're really good with taking the medicine. So that's not an excuse we can use. And then the cholesterol, we will check your lipid profile, but for now, everything stays the same. Keep trying to eat properly, exercising. Your weight's actually fantastic, so it didn't go up, and I don't have any other changes to make. Any questions on your side?
No, sir, I'm good. Thank you.
Right, and I think we'll plan to see each other back here in 6 months. Of course, if the allergies are bothering you, call the office and we'll go from there.
Sounds good. Thank you.
Okay, so that is an entire conversation. Of course, we were winging it. I didn't know what we were going to say, but you were a wonderful patient. And of course, verbalizing a physical is probably the hardest part. So this takes about 2.5 to 3 minutes, slightly longer, but it was also a longer recording. That took about 4.5 minutes. And probably realistically, if we were being friendly and talking about the weather or sports, I might not have started the recording till a bit later, until I knew I was going to get into starting the conversation about the different problems. But in a busy practice, if you're seeing 18, 20, 25 patients, yeah, you're probably just going to walk in, and the medical assistant might have already consented the patient, and either using an iPad or a dedicated phone. The phones have phenomenal capture. It would work really well. I'm going to switch over, and let me see. I could have. Let me see. I think I will share my screen and pop open. It might take a minute, but we're going to log into our. So what Dr. Emenuga didn't show you is you come to the website, you just go to a login. She has a login, and this is my clinical account, and it logs me into my homepage. And my sessions for that week or day are here. We didn't get into this, and we should have. The affordability of Calarity comes from the fact that you pay as you go. There is no fixed monthly fee. So when you sign up for Calarity as a clinician, you get 60 minutes of time. What Dr. Emenuga did on the first 2 dictations was probably less than 2 minutes. And so each clinician can try Calarity on probably 30 to 40 patients before they ever have to pay, or the organization would pay. And we deliberately did that because not every new technology is the right fit for every person. And it seems more fair to let everyone try it to see if this is something they could work with, and it truly saves them time. And doing it on 30 or 40 patients is fantastic. The last one, the release the version that we're going to release next month, that one took 4.5 minutes. So it takes longer, but it does end up doing a more thorough job.